Let me explain some keynote about the antibiotics. So the patient should be instructed to complete the full course of therapy. So if you start the antibiotic for any disease, you have to complete the full courses. It is not good suddenly stop the antibiotics. We could educate our patient, complete the doses, and complete the total duration of antibiotics. Avoid the here let basically I'm going to talk about some particular information related to antibiotics. So avoid the cephalosporin in the client allergy to penicillin. So if you know the patient have a history of allergy to penicillin, it is good to the patient also avoid cephalosporin, right? The penicillin basically we use for gonorrhea, pneumonia, or urinary tract infection, UTI. The most common penicillin we use amoxicillin or ampicillin and penicillin itself, right? So when you patient need penicillin, the first question you should ask about the history of allergy. So what you should ask about any kind of reaction such as itching, rash, or hives. So we do not give the penicillin if any reaction has occurred in the past. But good things is penicillin safe for pregnancy. But here I want to tell you, if my patient have a history of allergy to penicillin, you do not give cephalosporin as well. The cephalosporin basically we use for gram-negative bacteria infection, or we use for urinary tract infection or UTI, pneumonia, gonorrhea, right? So most common cephalosporin we use is called cefazolin or ceftriaxone. So the group of drugs combined called cephalosporin, like cephalexin, ceftriaxone, cefazolin, or ceftriaxone all together, right? So what are the notes we learn from here? We learn do not give to the patient if they have allergy to penicillin. So now I want to tell you something more about the cephalosporin. So remember, the cephalosporin can cause a hyperglycemia. So if your patient have a diabetic, they has to adjust the insulin doses. Sometimes cephalosporin can cause anaphylactic shock. And they have also nephrotoxic, and also they can cause thrombocytopenia, right? So now question comes, if my patient have a allergy to cephalosporin or penicillin, what you should give them? You should give them mycin or tetracycline or macrolide. What is mycin? Mycin a group of drugs like aminoglycoside, tobramycin, gentamicin, amikacin, neomycin, all together we call mycin. So if my patient have a cephalosporin or penicillin allergy, you give them aminoglycoside, gentamicin or neomycin, or you give them tetracycline or doxycycline, or even we give them macrolide. So macrolides drugs including erythromycin, clarithromycin, erythromycin, or clindamycin. Cephalosporin increase the risk for Clostridium deficit infection, right? Cephalosporin can cause. So question come, what are the other note we have to know about cephalosporin? So give 1 or 2 hours before the dinner or lunch. If your patient has to take the mycin, like aminoglycoside or amikacin neomycin, what we have to know about this? So aminoglycoside, first of all, or mycin drugs we use, it is very powerful antibiotics to treat the condition like meningitis. I'm talking about this group. Infective endocarditis, septicemia, or patient infected by Clostridium deficit. So this mycin has a common side effect. They can cause ototoxicity, neurotoxicity, and nephrotoxicity. So they are not good for your kidney, right? So we could monitor blood urea nitrogen and we could monitor the creatinine level. Again, I want to recap it. The aminoglycoside or mycin group causes the ER or ototoxicity, can cause kidney damage or nephrotoxicity. So effect on hearing, patient complain the ringing inside the ear or patient complain the dizziness. Keep in mind, mycin like aminoglycoside do not give during the pregnancy. And if you give the patient, it is good to check the blood level. Okay. And here, another one, do not give tetracycline to the pregnant women and children under age of 8 years because they can cause the strain in denture. So tetracycline, the example of tetracycline we use like tetracycline itself, doxycycline, minocycline, or democycline. Tetracycline is a drug of choice for urinary tract infection, pneumonia, gonorrhea, or syphilis. And tetracycline we give if patient have allergy to penicillin, if patient have allergy to cephalosporin. But they can cause photosensitivity or nephrotoxicity and also hepatotoxicity. So if your patient took tetracycline or doxycycline, tell them keep out of direct sunlight because they have phototoxicity effect. Also, patient should monitor the liver enzyme, monitor the kidney function because they nephrotoxic and hepatotoxic. And tetracycline do not give if patient is pregnant. And also keep in mind here, pregnant women, okay, take on empty stomach. And do not take with antacid, do not take with milk, do not take with yogurt. And doxycycline better to take with full glass of water and remain upright for 30 minutes. Let me recap it. We do not give tetracycline or doxycycline if the patient is pregnant. We do not give with cow milk. Do not give to the children under 8 years old because it will cause the teeth to turn black. So what you should tell your patient, give this medication with a straw and avoid giving with Lasix. What next? Ciprofloxacillin, right? Ciprofloxacillin, actually the group of drug we call fluoroquinolone. It is including ciprofloxacillin, moxifloxacillin, levofloxacillin or ofloxacillin. The ciprofloxacillin, a major side effect here in the picture you can see, they can cause tendonitis or tendon rupture. So ciprofloxacillin is like a tetracycline. They are also can cause photosensitivities. They can cause photosensitivities. So ciprofloxacillin we use for bacterial infection, respiratory infection like anthrax or urinary tract infection. And also they can cause GI upset like nausea, vomiting, diarrhea. Okay, so they said Cipro either 2 hours before or 6 hours after taking antacid, multivitamin or iron, and do not take with milk or yogurt like tetracycline. And take the macrobit with food to improve the absorption and prevent the GI upset. So macrobit basically we call nitrofurantoin. Macrolide, this macrolide, nitrofurantoin, they can cause chronic pulmonary reaction. They can cause GI upset, dizziness, pruritus, fever, jaundice, also angioedema, or even some patient present with Steven-Johnson syndrome, hypersensitivity reaction in case of macrobit. Macrobit with food to improve the absorption and prevent GI upset because they can cause GI upset. Give the isoniazide, shortly called INH, with vitamin B6 to prevent peripheral neuropathy. So isoniazide actually antitubercular agents. So anti-TB medication like INH or isoniazide, rifampin or ethambutol. So isoniazide can cause peripheral neuropathy, or also anti-TB drugs can cause hepatotoxicity, discolor the urine, or they even discolor the contact lens or visual disturbance. So educate your patient to take vitamin B6 pyridoxine to prevent peripheral neuropathy because of anti-TB by isoniazide. They can cause peripheral neuropathy as a side effect. So anti-TB medication may be given in combination to prevent resistance. So anti-TB drugs, what combination? Combination by isoniazide, rifampin, or ethambutol or streptomycin. Also avoid the ethyl alcohol with Fragile. So Fragile, basically metronidazole, we use for gastrointestinal infection or very bad diarrhea even. The Fragile can cause metallic taste or dark red-brown urine. Important for NCLEX board. And here macrolide, basically a group of drugs we call macrolide, azithromycin, clarithromycin, erythromycin, and clindamycin. And these groups of drugs can cause thrombocytopenia, means platelet go down. Sometimes patient has abdominal pain, taste change, or superinfection. But most important, macrolide, sometimes some of the patient develop Stevens-Johnson syndrome. What are the other medication can cause Stevens-Johnson? Antibacterial like macrolide or nitrofurantoin. So all of the information or NCLEX keynote here, it can help to pass our NCLEX board.